Greetings, distinguished guests, and thank you for this opportunity to say a few words at this year's event 201, the high-level simulation exercise for pandemic preparedness and response, hosted by Johns Hopkins Centre for Health Security, the World Economic Forum and the Bill and Melinda Gates Foundation. Unfortunately, I was not able to join you today. I'm involved in the IHR Emergency Committee for Ebola, but I had hoped to be in the room with you, because the issues you will be dealing with over the next hours may be tabletop exercises today, but they address real and critical threats which we at WHO take very seriously. Without a question, epidemic risk has become a global strategic concern. I don't think we've ever been in a situation where we have had to respond to so many health emergencies at once. This is a new normal. I don't expect the frequency of these epidemics to reduce, and in fact, vulnerabilities all over the world, developed and developing countries, have increased, not decreased, driven by many, many factors, mainly through human behaviour, economic development, population density, and many others. The scenario you will be presented with this morning could easily become a shared reality one day. I fully expect that we will be confronted by a fast-moving, highly lethal pandemic of a respiratory pathogen. The question is, are we prepared to globally respond to the next major pandemic event? Are we ready to cooperate and perform across countries and across sectors to face such a threat? Have we established the surveillance and risk assessment systems, the communication tools, the supply chains, and the business continuity plans that will be needed, not only to protect health in a major epidemic or pandemic, but to protect economic development, to protect political and social systems? Do we collectively drive innovation enough to face the evolving global threats which we are anticipating? The nature of pandemics is that many countries will be affected at the same time. This is particularly true with the respiratory pathogen, as they are often transmitted by asymptomatic persons. They spread fast. In 2009, the pandemic virus reached all continents in less than 9 weeks. WHO's priorities are to establish a minimum capacity to detect and respond in each country around the world, to develop global strategies for the containment and control of individual disease threats, and develop global mechanisms to ensure cross-sectoral and multinational, multilateral coordination. Innovation and partnership across all sectors are needed, including joint strategies between global health leaders and the drivers of travel, communication, data technology industries. WHO is working at all levels through a variety of partnerships to strengthen national and regional preparedness, such as GORN, the Global Outbreak Alert and Response Network. Through the PIP framework, adopted by WHO member states in 2011, WHO has secured 400 million vaccine doses for influenza, 10 million antiviral treatments, and 250,000 diagnostic kits for the next pandemic. We have completed external evaluations of surveillance and response systems in over 100 countries and carried out more than 50 simulation exercises at country level, looking for vulnerabilities and weaknesses in national systems. This voluntary, collaborative, multi-sectoral process helps countries to assess their capacities and identifies the most critical gaps within their health systems in order to prioritise opportunities for enhanced preparedness and response. The Pandemic Supply Chain Network, part of the Epidemic Readiness Accelerator, which is a project of the World Economic Forum in partnership with many, including WHO. It's a public-private collaboration to develop a globally connected supply chain that can support health emergency operations during a pandemic. Stakeholders consist of product manufacturers to logistics providers, distributors, and UN partners, including ourselves. Michael Griffin is WHO's focal point for the Pandemic Supply Chain Network, and he is there with you this week. Constant innovation and the use of cutting-edge technology is key to pandemic preparedness. In order to pool data and analytics at a global scale for disease prevention, the EpiBrain initiative, a global data ecosystem, aims to build a collaboration of big data networks to understand and predict epidemics. It supports data science, innovation for outbreak preparedness and response. Despite this progress, there is still much to be done. Cross-sectoral simulation exercises, such as the one you will be experiencing today, contribute to a better understanding of the critical gaps, the cooperation required from global businesses, response decisions required from government and public health leaders to minimise large-scale economic and societal consequences of a severe pandemic. I wish you the best of luck, and we are looking forward to working with each of you to strengthen pandemic preparedness in the future. Thank you.